Thoracic outlet syndrome, or TOS, is a group of disorders caused by compression of nerves and blood vessels in the upper chest area, specifically at the thoracic outlet. This region is where nerves and vessels pass from the chest to the arm, and any narrowing, whether congenital or acquired, can lead to symptoms. The main anatomical structures involved include the scalene muscles, the first rib, sometimes an extracervical rib, the costoclavicular joint, and the pectoralis minor muscle. TOS can present as neurogenic, venous, or arterial types, each with its own set of symptoms. The path to a correct diagnosis is often long, as symptoms can mimic other conditions and may be quite varied. Understanding the basics of TOS is crucial for recognizing its impact on patients' lives and the importance of timely, accurate diagnosis. Symptoms of thoracic outlet syndrome are diverse and depend on which structures are compressed. Common complaints include pain radiating from the shoulder down the arm, numbness, tingling, and sometimes weakness or loss of dexterity. Venous involvement may cause swelling or a heavy feeling in the arm, while arterial compression can lead to fatigue, coldness, or color changes in the fingers. Diagnosis begins with a thorough medical history and physical examination, including special maneuvers like the ADSON and AER tests to provoke symptoms. Imaging studies such as X-rays, CT, MRI, and duplex ultrasound help identify anatomical anomalies or vascular compromise. Electrodiagnostic tests may also be used to assess nerve function. Because symptoms can overlap with other conditions, a careful, interdisciplinary approach is essential to avoid misdiagnosis and ensure appropriate treatment. Treatment for thoracic outlet syndrome is tailored to the individual, depending on the severity and underlying cause. For most patients without severe neurological or vascular complications, conservative therapy is the first step. This includes physical therapy to improve posture and muscle balance, pain management, and sometimes ergonomic adjustments at work. In some cases, injections may offer temporary relief. Symptoms persist or complications arise, surgical intervention may be necessary. The most established surgical approach is the transaxillary resection of the first rib, often now performed with robotic assistance for greater precision and reduced recovery time. Surgery aims to relieve compression by removing the offending structures and restoring normal function. Postoperative care is crucial to prevent complications and ensure the best possible outcome. With proper management, most patients experience significant improvement or complete resolution of symptoms. Outlook for patients with thoracic outlet syndrome is generally positive, especially when the condition is recognized and treated appropriately. Early diagnosis and intervention can significantly reduce the duration and severity of symptoms, improving quality of life. Surgical treatments, particularly when performed in specialized centers, have high success rates with low complication risks. However, the choice of therapy must always be individualized, considering the patient's specific anatomy, symptoms, and lifestyle needs. Awareness of TOS among healthcare providers is essential to avoid delays in diagnosis and to provide optimal care. Ultimately, a multidisciplinary approach ensures the best outcomes for patients, helping them return to normal activities with minimal limitations.